One thing we are very focused on these days is how we tackle brain aging. It's part of the normal physiological process, but then we also hope that we can devise a certain way of, on average, delay the onset of dementia by a year. It's been estimated that by 2050, the number of patients living with dementia would be reduced by 7 or 8 million. So obviously the brain is an extremely complicated organ. Given if we have better understanding, can we then devise better therapeutics for tackling these devastating medical conditions? So in order to study its function at different levels, we need techniques that can allow us to see its operation at different organizational levels, meaning that at the molecular level, how different proteins, different genes inside each of the neurons, inside each of the brains, they interact, how they function, how they change their expression or interaction in disease conditions or in the aging process. So I've always been interested in biomedical sciences since I was a kid. I dig into more details of something called Hodgkin-Huxley model. That was a Nobel Prize winning work in 1963. What they did was devising a set of differential equations describing how the regenerative event called action potential occur in neurons. Eventually, I decided that I want to do neuroscience. It satisfies my natural curiosity of how the brain works. When you dig deep enough into a certain field, you certainly want part of your knowledge to become applicable. I still think that having a clinical exposure, having a completed clinical training is actually helpful in terms of guiding what kind of questions, what kind of unresolved problems are there awaiting. I will be extremely eager to build up a team that is as multidisciplinary as possible, meaning that we need members coming from all different kinds of diverse backgrounds. We have to interact a lot, we have to go back and forth discussing approaches to solving different problems. We need people who are good at mathematics and imaging. We need people who are extremely good at chemistry so that they can develop new protocols, new techniques.
Oh, my first impression of Owen is he speaks about the brain like nobody else and always gives insightful comments and also solutions to very difficult problems.
We discuss project idea, we discuss aspirations, what we want to do in the future, how do we want to tackle problems related to the brain.
Sometimes we will engineer a new protein just to visualize some structures that can never be seen before, and sometimes we can just literally change one substance to another to make it have the properties that we want, so that we can visualize many neurons at once and many of them in a very full brightness and also in multiple colors, something like that. Those are all fancy stuff, but that would make the image more appealing and at the same time more information for Dr. Ko to analyze.
Speaking of the commercialization part, right now, because we are still at the stage of completing the scientific part, meaning that in order for something to be commercialized, you not just have to demonstrate it in principle, you have to devise a way of demonstrating that it's super reliably reproducible.
So that's how discussion with ORKTS helps, because I would need to talk to different advisors regarding a patent, and they would feedback to me on how I can make this patent more secure and also more protected. How can we sell it? Despite it's the same scientific idea, discussion with all these experts and also the advisors definitely helps me to think in a more marketable perspective.